You're over your surgery, you just had it, and now you're wondering, what do we do and in what order? And you probably threw away or didn't read all the papers we got you, and were probably so excited about surgery you couldn't remember. So I'm here to tell you about the first few days after surgery and what you're going to experience. First of all, you probably noticed that your incisions are healing really well. And we think it's important that you go ahead and shower and wash them. Most wound infections come from patient skin. So the simple act of showering will help you keep from having a wound infection. Don't need to cover them with Band-Aids, although sometimes if you find that a wound is underneath a bra or underneath the breast, or for men sometimes underneath the breast, just a dry gauze, not a Band-Aid, is all you need to kind of keep it up. But what do you eat? What is the progression? Well, I want you to think of your new stomach as being like a baby stomach. You may have some sense of restriction, you may not. We don't care at this point. Here's what we want you to do. First 24 hours are pretty easy, just clear liquids. Warm liquids do best. They should go down easily, they should go down smoothly, they shouldn't back up. If they do, we want to know about it. After the first 24 hours, we want you to start on what we call full liquids. And there's a complete description about that in the website. So for the first 7 days, you're going to be on liquids. Drink a lot. In fact, we find the more you drink, the better you're going to heal, the better you're going to feel. One of the things that the band does is you'll notice it suppresses your appetite. It also suppresses your thirst. So it's important to remember to make fluids a real important component of your day. Always carry around a bottle of water. As you go into the next week, you're going to start on some soft foods. And soft foods are just that. They're foods that are soft. They're designed so that they'll go into your stomach. They won't last you long. They're not going to necessarily give you a sense of satiety, but they'll kind of warm you and make you feel a little better. Things like mashed potatoes. But then we want you to get out of the soft foods and into the solid foods at a comfortable rate. Let's talk about foods that you should avoid. You should avoid white bread during this time. You should avoid white pasta. You should avoid sticky white rice. You should avoid dried chicken. And you certainly should avoid rubbery eggs. One of the things with scrambled eggs is if you make them and don't use ingredients or you put them in a microwave, they'll be rubbery and they'll stick. So just avoid those things altogether. Those are things that you'll find will work best, not with you and not with your weight loss plan. As you go forward, continue eating. Now the most important part of the band is that it's adjustable. But how do we know when it needs adjusting? It's pretty simple. It's when you have a small amount of food and it lasts you for a long period of time. You're going to notice early on a sensation. You're going to notice there's a sensation of you've eaten enough. The band is telling you stop. And that's okay. But I want you to know this sensation doesn't last forever. And you should never use that sensation to tell you when to stop. Obviously, if it tells you to stop, pay attention to it. But that's not what the purpose of the band is. It's just a benefit early on. What we want you to do is portion control. So here's what we'd like you to do. When you're in your solid phase, take a small plate, like a bread plate or a salad plate. Put the portions out on there specifically. 4 ounces by volume, not by weight, of your meat, fish, or poultry, and 6 ounces of your vegetables. Start eating that. Sit down, make a production of it. Don't stand and eat, don't rush and eat, and don't drink and eat. Drink all your fluid before, put the meal down, and start eating. Do not ever, ever, ever finish your plate. This is not a clean plate club. Stop when you feel a first sense of a little bit of satiety. Put the food away, you're done. Never ever go beyond that amount. That's when slips occur. Instead, eat a comfortable amount, push the plate away, and then what I'm going to want to know when I see you again in 4 to 6 weeks is how long that lasts you. Don't be surprised at different times of day with different types of food that'll last different amounts. You may not even want anything for breakfast. In fact, the only thing you may want for breakfast is a cup of hot coffee or tea, maybe a little yogurt. That's fine. But for lunch and dinner, we want you to have a little bit of protein and some vegetables. So that's it. Those are some early rules that'll help you a lot. So welcome to this side of the weight loss world. Your surgery's over. You've done great. Now let's start using the tool. Thanks.